Hey guys, welcome back. You're still tuned into Business Lunch. The government has notified the Uniform Pharma Marketing Code that bars all gifts to healthcare professionals and their families as well. It will also hold CEOs of pharma companies accountable for adherence to the code. Timsy joins us to take us through all of the details on this one. Timsy.
Well, yes, as you rightly mentioned, the government notified Uniform Code for Pharmaceutical Marketing Practices, UCPMP 2024, last evening. The code clearly says that no gifts should be offered or provided for personal benefit of any healthcare professional, family members, by any pharma company, their agents, distributors, wholesalers or retailers. It also says that the pharma companies and representatives should not extend travel facilities inside or outside the country, including via rail, air, ship, cruise, tickets, paid for vacations, etc. to healthcare professionals or family members or who are attending either conferences, seminars, workshops, etc., unless the person is a speaker at that particular event. Pharma companies or representatives should not extend hospitality like hotel stay, expensive cuisine, resort accommodation, etc. to, again, these healthcare professionals or their family members, again, unless the person is a speaker. The code also says that the pharma company representatives should not pay cash or monetary grant to any healthcare professional or their family member. When it comes to the complaints, the code says that the complaints of violation of the code will be handled by Ethics Committee for Pharma Marketing Practices in each association, and each of the pharma company has to be part of an association. The Ethics Committee will be headed by the association's Chief Executive Officer and should have a composition of 3 to 5 members, which will be approved by the board of the association and should be prominently placed on the website of the association. Not just this, the CEOs of the pharma companies will be held responsible for adherence to the code. The code says that CEO of pharma company to be responsible for adherence to the code, a self-declaration shall be submitted by the executive head of pharma company within 2 months of the end of every financial year to the association. And that self-declaration is an annexure that is also a prescribed format that the code says. It also says that the self-declaration will be uploaded on the association's website or directly on the UCPMP portal of the pharmaceutical departments. Not just this, when it comes to free samples of drugs, it says that the free samples of drugs shall not be supplied to any person who is not qualified to prescribe such a product. Each company should maintain details of such products with the product name, the doctor's name, the quantity of the samples given, date of supply of free samples to healthcare practitioners, and the monetary value of the samples so distributed should not exceed 2% of the domestic sales of the company per year. So all this packed in a crisp code. That's what this new code talks about. Let's see how soon the pharma companies adhere to the code.
All right, MC, very, very clear messaging coming in from the government to the pharma professionals in this particular code. Now, moving on